You think it's bad, right? It can get worse. Fake doctor operates, patient watches tutorials on YouTube, and the patient dies. Have you ever wondered about being operated on by someone who's not actually a doctor? Which is it? Is he just watching a YouTube tutorial? Like, man, it's bizarre. I have to tell you this because, every day that goes by, you guys think it doesn't happen. Many so-called professionals lack proper qualifications, not just in medicine, but in other fields too. I'll read you this story to help you stay aware. The other day here in Brazil, there was another fake doctor. The guy was studying medicine, but he was working shifts as a doctor. This one was a fake doctor. You'll understand the case. By the way, don't forget to like, share, and subscribe. That way, you help us create this content. Always stay alert, okay? Not everything is what it seems. Let's go. A woman died after undergoing surgery performed by a man who pretended to be a doctor and watched a YouTube video during the procedure. The fake professional was drunk during the illegal operation. The case happened in the city of Barabank in India. So, it didn't happen in Brazil, okay? But still, be careful, right? Because it happened in India and maybe it hasn't happened here yet, or maybe it just hasn't come to light, hasn't become public, okay? The victim sought medical attention in December after experiencing severe abdominal pain. She was taken by her husband to a clinic that was operating without a health license or registration with the Department of Health. Guys, this is for us to stay alert. A clinic that operates like a subclinic, I want to say, because it operates without authorization, a very cheap clinic. The prices are way, way below average. Be careful, everything in life has a price. Don't think you're smarter than most people and that you're going to pay a third of the price for something. This happened in India, but here in Brazil we know. I have one. I'll share it later. I have a nurse who worked with me. She paid cheap for a silicone implant and it turned out crooked. I'll tell that story later, in detail. For you, okay? According to the husband, the owner of the place misdiagnosed the problem as being caused by stones and said that immediate surgery would be necessary. What did I understand? So, he didn't think it was gallstones, because stones, you don't do surgery for kidney stones, right? You do laser surgery, right? So I imagine it's gallstones. I imagine it is even without medical training. He started the procedure while watching a tutorial on YouTube. Family members also reported that he appeared to be drunk at the time of the surgery. Guys, for God's sake, man, how can you let someone in your family be subjected to anything by a professional with traces of alcohol? Guys, the bill will keep coming, so be cautious about how it arrives. When warning signs appear, something bad is on the way. The trouble is already signaling its arrival. Maybe it's a place that's just too cheap. A professional there, whether they're labeling someone as an alcoholic or not, anyway, the drunk guy, something like that. Man, it's giving you a warning. Are you going to keep going? But they kept going, right? During the operation, that woman, right? He got help from a nephew. The doctor called a nephew to help, who also wasn't a doctor, right? If he was, he'd say, I'm not a doctor. I'll call my nephew to help, okay? According to complaints filed with the police, both made deep and uncontrolled incisions, rupturing important arteries and veins. You shouldn't open an abdominal cavity without thorough anatomical knowledge. The mess you're going to make, I don't even have the courage to use a scalpel on someone's belly because my knowledge of anatomy doesn't allow me to perform the surgery. That's why, to become a surgeon, the guy studies for at least 5 years, then there's general surgery, and after that, the specific surgery. So first the guy studies, then he observes, then he joins the staff. Anyway, the thing is, the process is slow. Guys, for God's sake, but people here are crazy, right? Let's go. The patient started bleeding. Obviously, right? Because imagine if you cut a major artery. She also didn't get any anesthesia. Oh man, I would have stopped right there. Man, seriously, you're in a place to have a surgical procedure, someone's going to cut you without anesthesia, and you're going to go through with it? My friend, as soon as the guy even touches me, that's it, man. I felt that pain for everything. I'd rather die from the pain of the stone, since they said it was a kidney stone, than this, man, for God's sake. I just can't. It's a story that's hard to swallow. How does someone keep going with the procedure, man? Seriously? She wasn't given anesthesia or basic sterilization. Imagine sterilization, I'm not even blaming, right? After all this, educating, not being a doctor, so demanding sterilization here is just unfair, right? Continuing, the patient's condition rapidly declined, hypovolemic shock. She was taken to a public hospital the following day. But she couldn't withstand the complications and died on the night of December 6th. Damn, man, she died that day after searching for a place and being treated by someone who wasn't a healthcare professional. Man, there's a lot of things going wrong here. The autopsy report confirmed that the cause of death was internal bleeding caused by poorly performed cuts. Ruling out appendicitis or gallstones, in other words, the autopsy showed that she didn't have gallstones or appendicitis. In other words, they performed an unnecessary procedure in the wrong way without anesthesia by someone who wasn't a doctor. With help from a nephew who probably wasn't a doctor and in a clinic with a drunk guy, seriously, what are the odds this works? Tell me, out of all this, am I supposed to glorify it and say, wow, the guy was a hero, he wasn't even a doctor, he just did what he could to feel good for God's sake? Guys, let's stay alert, okay? Today in Brazil, we have a growing number of medical professionals, all right? But just because someone is studying medicine doesn't mean they can perform surgery while drunk anywhere in subhuman conditions. Of course, I'm not going to compare Brazil with India. Let's say we have much more strict procedures than some places in India. So, since I don't know their culture, I can't say. But coming back here to Brazil, even in Brazil, with all these issues, they exist. In São Paulo, there have already been many reports of backyard clinics, clinics in apartments, clinics. The guy does procedures up there, so be careful. It's your life. If you can't afford a good professional, save up and do it later. In Brazil, most of the problems that happened were cosmetic procedures. We rarely had problems with someone who went to have a procedure like, I don't know, an appendectomy, cholecystectomy, or something like that. Here in Brazil, we go to a public or private hospital, but you could die waiting for surgery. But the problems we have in Brazil are more related to cosmetic procedures than something like that. But unfortunately, this patient and her husband, they looked for it, unfortunately, right? It could have been avoided.